Welcome to this pocket program. My name is Elaine Zhang. I'm an education specialist with Fireland's Education Department, and today I'm going to teach you on how to use an AED. What is an AED? An AED is an Automated External Defibrillator used to detect abnormal rhythms and can be used to help with CPR. Public access to an AED and community training is important to making sure that AEDs are used properly. When used properly, AEDs can help increase the chance of survival by 67%, and adding CPR along with it can make it an even higher chance of a person being able to survive. There are many different AEDs out there, but all of them can be used in a similar fashion. AEDs, along with CPR, can help prompt you how to help somebody survive. Today, I'm going to show you how to use an AED. The first step in using an AED is knowing when you actually need to use an AED. So assessing a person on whether they need help. So first off, you would ask that person, tap and shout at them and see if they respond. If the person does not respond or does not show any sign of breathing, then they are going to need help. In order to help them, first thing you're going to have to do is call 911 and get the AED. If you're alone, the first thing you're going to want to do is go get the AED and call 911 right away. If someone is available to help you, you would have them call 911 and get the AED while you start hands-only CPR. Hands-only CPR is very simple. You get on the chest, you're going to give compressions at a rate of 100 to 120 beats per minute at a depth of 2 inches. And you're going to continue that until the AED arrives. When the AED arrives, the first thing you're going to do is turn it on. The AED will prompt you when turned on how to use it. You do need to make sure that you have removed articles of clothing. If there is an implanted device or jewelry, you need to try to stay away from those with the pads. If the person is hairy, you are going to need to shave the chest area before the pads are applied. That razor should be provided in the kit with your AED, along with a towelette if needed, gloves, an alcohol wipe, and any other equipment that has been provided with the AED. Next step will be to apply the pads. Applying the pads is very simple if you follow the pictures on the package. The pictures on the package do show you that one needs to be placed up and one needs to be placed down. Once the pads are applied for the AED, it will analyze the heart rhythm. The AED will detect if there is an irregular rhythm that it can shock. The AED will tell you during that analyze to stay clear. That means that nobody should be touching the person while that AED is analyzing. Once the AED is done analyzing, it will tell you whether a shock is needed. Once the AED has analyzed that a shock is needed, you will need to clear the patient and push the shock button, which should be highlighted on the AED. If the AED says no shock is needed, you should start CPR right away, unless the person speaks or sits up or shows signs that they are conscious. You will continue CPR for 2 minutes until the AED tells you that it needs to reanalyze. Then you will clear the patient and follow the same prompts again. You will continue this until the person is awake or your emergency services have arrived to help. Thank you for watching this pocket program on AED training. I hope you will feel more comfortable to use an AED when it is needed and to help save a life.